Hi, I'm Dr. Amber. I'm a small animal rehabilitation vet and I specialize in advanced aging and geriatric pet care. And today I want to talk quickly about supplements versus medications. Most people tell me that they want to go the natural route, that they want to avoid medications. I had one wonderful client tell me the dog was 15 and never been on drugs her whole life and would like her to not be on them if you don't need them, right? And I think the big thing that we need to talk about is the difference in expectations between supplements, herbs, and medications, right? So when you get a supplement, we are trying to support the body's natural ability to do something, whether it is to detoxify your liver, support your kidneys, help your joints, help your muscles, whatever the goal of that supplement is. And I have a couple rules for my supplement companies. One, I want them to be well-established companies that I know. Two, I want to study on their specific supplement that says their supplement works. I don't like seeing studies from other people's supplements saying this product should work because mine has the same composition. So for my trust level, I tend to trust companies that have very specific rules on what they would call their product and that they have done studies on their product proving it works, it's safe, and I don't have to worry. And then the second thing is our expectations for medications are different, right? Medications we're using to resolve a current issue, to prolong signs of a specific disease or condition, or something like relieve pain quickly, right? So medications tend to have a more significant, faster response for specific conditions than supplements that are more of a long time support system with the goal of reducing medications over time. So when I have, since I specialize in rehab, when I have an acute cruciate injury. So I have a very painful dog who can't walk on the limb. So now we have damage to the joint, we have damage to the soft tissues, we have a painful pet, and we have a pet who's not moving their body appropriately. I will start them on supplements for that joint. I start them on supplements to help remove toxins, to reduce inflammation, to help support the cartilage, to help support the muscle. But I know those can take up to 3 months to really max out their effect. So in the meantime, I do need to add in an anti-inflammatory and pain medication so the pet is better able to tolerate pain. They're better able to exercise and be functional. They're better able to be successful at their current state with our goal of 3 months down the road, reducing their medication load, right? And every medication should be done for a specific reason. And if you don't know the reason you're being prescribed a medication, you should ask, right? So sometimes I get resistance because I'll sometimes get pets for rehab 4, 6, 12 weeks after an injury when they've already been on courses of pain meds, they've started their own supplements, and they're not succeeding. So I will a lot of times restart medications when I get them because now I need your dog to walk on this limb, load this limb, practice exercises, and I want quality and pain-free. It is not fair to ask a pet to exercise and be successful on a painful joint, right? So for me, if we're using rehab as a structure, what I'll typically do is start on pain medications and anti-inflammatory so they're not in pain, they can be successful. And then I start my supplements with the long-term goal of reducing my medication load. And usually what is kind of cool is we can start to prove what they need and what they don't need. We can prove that they need their pain medication by reducing it, by doing every other day, versus doing something like proving they need a supplement. If we reduce the supplements and they don't thrive, then we have to add them back in. So if you have a question on why you're being prescribed a supplement or a medication, make sure you clarify that with your veterinarian so you feel comfortable with your plan going forward. Have a great day.